Hi, everyone. First off, happy Women's History Month. So for this month here at Power to Decide, we're bringing together these amazing young people to discuss women role models in their life, as well as where we see the future of women's health going. First, I'd like to go around and have everyone introduce themselves so you can say your name and what you do. Mallory, can you start us off?
I'm just saying my name, right?
And what you do, yeah.
Oh, okay. I took the second part. My name's Mallory. I have my degree in public health, my master's degree concentrating in maternal and child health. I now work at the George Washington University overseeing fitness programming, but sexual and reproductive health has always been a big passion of mine. I worked at NARAL and Emily's List in college, and I continue to do volunteering on the side. So very excited about this today.
Awesome. Go ahead, Kyla.
Hi, my name is Kyla Horn. I am the program manager for All Access EKY. All Access EKY is an initiative coordinated by Appleshop, Kentucky Health Justice Network, and Power to Decide, and we help ensure that all young people have access to the full range of birth control methods.
Thanks. Deekshita?
Hi, I'm Deekshita. I also have my master's in public health in maternal and child health from GW, and I currently work with the Maternal Health Initiative, which is a program within the Wilson Center, a think tank based in DC focused on foreign policy issues. I specifically work on programming focused on maternal and global health, sexual reproductive health and rights, gender equity, women in the workforce, and other related issues on women, gender, and maternal health.
Awesome, thanks. Temi?
Hi, I'm Temi. I'm the Digital Programs Fellow at Power to Decide. I mainly work on the Contraceptive Deserts Project, so a lot of our clinic work. And also, I've just been interested in sexual and reproductive health for a while. While I was getting my bachelor's degree, I worked with like Planned Parenthood and a Young Women's Project and other organizations focused on sexual health and reproductive justice. This has always been a passion and interest for me.
Thanks, Temi. Ciara?
Hi everyone, my name is Ciara. I actually have a master's in theological studies from Harvard University with emphasis on LGBTQ inclusion, and I think a lot about the intersection of progressive theology and reproductive rights. Currently I work for UC Berkeley as their diversity and initiatives coordinator, and I also run their undergraduate scholarship program for public policy students.
Thanks. And I'm Sam. I have a master's of public health with a focus on sexual and reproductive health, and I'm the policy fellow at Power to Decide, working mainly on state policy and telehealth. So welcome everyone, let's get started. So my first question for everyone is, how has being a woman influenced your decision to get involved in the world of sexual and reproductive health? Deekshita, do you want to start us off?
Sure. I think it's very difficult for me to separate, or to really identify when I got interested in sexual reproductive health. I would say being a woman has, really been the starting point for it all. It's something that I've had to think about really my entire life. But more than my gender, I think being a South Asian woman, being within the first generation of immigrants, my parents immigrated here from India, seeing issues that intersected between race and gender was really what drew me to this work. I mean, from when I was young, experiencing microaggressions and racist incidents, growing up to seeing how the medical system works differently for you based on your race or your gender, all kind of culminating in some of my advocacy experiences in undergrad when I did a lot of campus advocacy around abortion access, and really realizing that the whole anti-abortion movement was about controlling women's bodies, not, being pro-life or whatever they claim to believe. So within all of that, I think is when I realized that this was the most important issue to me really focusing on making sure that all women, no matter race, your gender identity, class, etc., making sure none of those things prevented you from making a choice about your body and your health. But yeah.
No, thank you for that, and for bringing up the point of intersectionality. You can't separate parts of yourself, and we know that issues of sexual and reproductive health have a greater impact on women and people of color. So it's really important to highlight that. Do other folks have something to add or want to share their own experiences as a woman and getting into this field?
I guess I'll go just because I also come from an immigrant family and I'm also a woman of color. So I found it really interesting how you were talking about how that informed that, because I can also say similarly that did drive my decision to enter in sexual and reproductive health. I think that a lot of times immigrant communities are a lot less likely to talk about these issues. And I remember feeling in the dark a lot of times, like when I was in high school or college. And I think that for me, I found this really important because I realized that there was a community of people who actually focused on sexual reproductive health, and it wasn't really a third rail, I think, as we're kind of accustomed to growing up and believing. And I also think that my educational background in public health and also my past experiences working for like the Hillary campaign and also working or like being at first as like pre-med and like realizing that women's bodies are very politicized and non-men and also like non-binary people, non-men's bodies are very politicized in a way that men's bodies aren't. And while I sought to understand that, I realized that there was a place for me in sexual and reproductive health. So I just wanted to say that I think we kind of have like a similarity in the reasonings that we decided to be in the field.
Thank you for that point, Temi. And I also appreciate what you said about being in the dark through a part of your life about sexual and reproductive health. I think it's well known that we have ways to go in our sexual health programs. Mallory, Ciara, Kyla, do you have things to add? Perhaps your own experiences growing up and learning about sexual and reproductive health?
Yeah, definitely. Thanks for asking, and thanks for everybody for what you already have shared. And I think for me, it's a combination of like the personal and like the global, I guess. Like I grew up in a household, my mother is Black, and like she always told me from a young age that like doctors don't always believe the pain of Black women or our symptoms. And so I grew up understanding that there was an intersection between like racism and medical care, maybe even if I didn't have the language to understand it. And then I was really moved a couple years back around Serena Williams' story of her pregnancy. And at the same time, I was reading Thick by Tressie McMillan Cottom, I think is her last name. And her book, she also talks about like a miscarriage that she experienced as a result of poor medical care. And around that same time, I learned that I have ovarian cysts, and like that was misdiagnosed and miscarried for a long time when I first started having it. And so I think just the culmination of those experiences made me realize like, wow, like Black women and women of color and non-binary folks like and LGBTQ people, like we are not seen in this medical profession, and we need better language for reproductive care, and we need to really center the experiences of women of color and Black women as we do this work. And so I think it was these personal experiences, but also seeing other Black women who I really admire go through it made me realize that this is such a dire issue, and I wanted to bring it into the public sphere more.
Absolutely. And thank you for bringing up that these issues also affect the LGBTQ community and non-binary folks. As we're talking about ourselves as women for Women's History Month, it's also important to know that people who do not identify as women are affected by these issues. So thank you.
Definitely. I was inspired by what Timmy said. So yeah.
Thanks all. Kyla, Mallory, how have you guys been influenced to join this field?
I think I was definitely influenced by growing up in southeastern Kentucky. It is a very different world if you've never been there or heard about it. Appalachia is very deep rooted in specific beliefs. It's very religious. Growing up in school, I never had sex education. I was raised by my grandparents, like a lot of people in Appalachia. So that's a very taboo subject anyway, but especially with elderly people. So I was never taught about reproductive health or sexual health. And any questions I had, I turned to Google or the internet, and I was just fed a lot of incorrect information. And it got until I was in high school where I realized I have no idea about sex. I have no idea about my body. I had nowhere to turn to. And going to college, obviously, I learned a lot more. But when I was in college, I really wanted to know how to help people like me, especially young girls like me that were lost and didn't have anywhere to turn to. And by, you know, some amazing opportunity was led to All Access, and that's what I'm able to do. But I think that's what really impacted me.
Oh, that is a great point again about how our sexual health education is really critical in telling us and teaching us about our bodies and whatnot. So thank you. Mallory, do you have something to add?
It's funny. Yeah, I resonate with a lot of what you all were talking about. I don't want to sound like a broken record, but I also feel like I was in the dark in high school to my body and how it worked and what birth control was and which one to choose. And I think the root of a lot of this was my mom is a nurse and she was amazing with all of this stuff and really got me interested in sexual and reproductive health. But there's only so many things you feel like you can talk to your mom about in high school. And I still feel like with my friends, none of us knew what to do. And I'm from California, so you would think that, California would have great sex education, but I definitely felt like I was not getting the best education I could around sex. So I think that was the root of it. And then getting to college, I studied political communication in college, which with kind of an emphasis on sexual and reproductive health. And I worked in communications at both of at NARAL and Emily's List, and that made me so interested in the language we use around specifically abortion and how much shame and guilt we put on people who get abortions, and even around things that aren't abortion, like birth control and birth and etc. So I actually think I became very disillusioned at those places with how far we can get. Just the language, we seem to be losing the language battle. And so I think that was why I decided to get a master's degree in public health. And I was like, if I can deal with the access part, then like maybe I won't have to worry about the language thing. And now I see like we definitely need to do both things. But yeah, I think that was sort of the root of it, was being interested in how we were communicating about it and how that could improve over time. So we'll see about that one.
But that is a really great point. I mean, especially as we've all touched on that people who don't identify as women are affected by these issues. Our language matters, and it matters to make sure that people see themselves in our movement and in our field. So that's a great point. I also can relate to what everybody has said about not really knowing much about sexual health growing up. And it wasn't really until I, similarly to CR, was diagnosed having ovarian cysts and endometriosis that I realized, wow, there's a lot about my body I don't know. And in that, at least I, developed a passion for sexual and reproductive health. So I think it's really important that folks are taught about their bodies. As we think about what we've experienced growing up and our own experiences in the field, how do you guys want to see the field move forward? Kyla, if you want to start us off.
Yeah, definitely. I think that from my experience, I would just love to see less stigma surrounding sexual and reproductive health. I think that I would like for more young girls to be taught that, these aren't dirty things and these aren't things to be ashamed of. These are things that we all really need to know. It's crucial to not only our well-being, but to our health. I think that I would just love to see the conversation grow, from my perspective, especially in Bible Belt, Appalachian regions. I know that's a hard thing to do, change of mindset of whole groups of people, but I think that that would be a really great start.
No, absolutely. And I think a great step is sharing our own stories. That's what really changes people's hearts and minds. Tell me, how
I
would
think.
you like to? Oh, sorry. Go
I'm
ahead,
sorry. I'm so
Ciara.
sorry. No, Sam, go
No,
ahead.
go for it.
Sure. I was inspired by what Kyla said, and I just appreciated the. I mean, I know I mentioned at the beginning like my own passion for like working with Christian communities, particularly around this issue, and I would love to see our conversation around reproductive and sexual health move away from like morality and more into conversations that are agency centered and enthusiastic consent centered and pleasure centered, like, and not make it this kind of like either or, they're black and white. And when Mallory had mentioned abortion, like our kind of our moral judgment of people who get abortions mean that like people who are getting abortions don't get the emotional care they need, don't get the care they need for maybe grief that comes up after, and not grief because they made a mistake or wrong decision, but because loss is happening. And how can we be better about these conversations and be more nuanced? That's exciting for me. And the last thing I'll say is I would love to see, and this might be just our medical system in general, but I'd love to see reproductive care to go to treat like the whole person. Like recently I went for like a pap smear. I haven't gone for pap smear in a while, so I had to go for pap smear. And like I just really appreciated, like the doctor took like an hour with me, like just asking me about like how I feel about my body, am I in a partnership, what are my pronouns, like how, like, and really just took time. And like I left feeling so seen, and that was the first time I'd seen a gynecologist take that kind of time with me. So I would just love to see care move to that place, like just being gentle and taking the time with people to see how they're really feeling in their body. That would just be wonderful to see.
It's funny because I can't even imagine having a doctor like that. Like honestly, that seems like a foreign. Hearing that, like that doesn't exist. There's no way, right? I'm so happy you had that experience.
I almost like cried leaving the doctor because I had never had a doctor like show me that kind of care. So yeah, and it shouldn't be that way. Like that care was a standard of care, but we don't see it. And so it's just, yeah, thank you for saying that.
And it's so necessary to build trust too. Like these are very personal topics, personal issues, and you need the ability to build trust with your providers to really get at the root of your issues and make sure you're getting the care that you need. So I definitely appreciate that.
Going actually off of what Ciara, and I think I don't know if Mallory or someone else mentioned being a person or coming from a religious background, I think. So I actually came from a Christian background, and also I went to Catholic high school. And so sex education was during theology and was basically like, don't do these things and abortion is bad. And it didn't really teach us like the vocabulary around things with our body. And it's crazy because I believe that I had a great education. And I think that was a huge gap, especially in high school. And then going to college without that information and also not feeling very comfortable to talk about it with people. In my like growing up, it makes it kind of hard to like look at things on our own. And it's crazy too, because I think that a lot of us, like in our own generation, in our mother's generation, kind of recognize the feeling of shame, but we haven't really gotten past realizing the shame exists and actually dealing with it. I think a lot of people agree like this happened and it sucks, but we haven't really gotten to the point of treating it. And I think that what I want to get to the point is being able to be more offensive and improving our sex education for like high schoolers and middle schoolers and even for like adult women. So we don't have to, so that like while we're having these conversations, I think in an ideal world, I wouldn't want to have another like 22-year-old being like, I did not get sex education in high school and I just got like yelled at by a nun. I would prefer for it to be for us to live in a world where people don't really live in shame or fear and are able to have like the right vocabulary around these things, because I think that it does kind of stop us from progressing a lot in the movement.
Absolutely, yeah. Shame and stigma are something that are really challenging to overcome. And I agree, like we find ourselves on the defense a lot, and we should really be on the offense with these issues. I think, I don't know how the saying goes, but as we know, 1 in 4 women and probably more people get an abortion in their lifetime. And if you don't know someone, it probably means that person doesn't trust you enough to tell you. So I think it's really important we break down these barriers. Mallory, how do you see the future of women's health going?
Good question. So I guess I really agree with Kyla about less stigma. I wrote down in my notes, less judgment. And I think that extends to all topics of sexual and reproductive health, like what birth control you choose or none at all, choosing abortion or not, like how you choose to have birth, whatever area that is. But I think I liked what you said about like having more agency or maybe being on the offense. And one area that I'm really passionate about is there's a huge shortage of abortion providers because a lot of medical programs just aren't teaching abortion care in the programs. And so in the next like 10 to 15 years, it's going to be really, really problematic. Like there's not even going to be like access isn't even the conversation we'll be having. It's about like literal there being providers to provide the care in the first place. So I did a lot of research on that in the last year of my public health degree, because I think it's so important that more people get involved with, and like even just volunteering to help out with this, because it's going to be a huge problem. So access is obviously really important, but I think also just on the more public health medical side, making sure we're having providers in the pipeline to be able to perform these services long term, or else it won't even, like these conversations won't happen in the same way.
No, absolutely. When I was in college, I met an abortion provider from Rhode Island who would fly all over the country to provide abortions, and that is not sustainable at all. So that's a great point. Ikshita, do you want to add to our conversation? How do you see the field progressing?
Yeah, I have a couple of points to add. First off, I totally agree with what everyone has said so far. I think, unpacking a lot of the shame and stigma and judgment is a really important first step. I actually wanted to shout out a book that I read in December called, I want to get the title right. It's You're the Only One I've Told, something like that. But it's written by a South Asian abortion provider who's based in New York. But, like Mallory mentioned, abortion providers travel all across the world to provide, all across the country to provide abortion care. And this provider talks about all these different people's stories of what their experiences have been like with abortion and what they dealt with. And I really appreciated how each story attacked the issue from a different perspective that you wouldn't necessarily think of. But I also think it's really important when we think about the future of women's health, we have to confront the role of white supremacy in all of these issues. I mean, you cannot have a conversation about sexual and reproductive health and rights without a conversation of reproductive justice. I mean, everything we know about women's health, reproductive health, maternal health, all of this knowledge was, I mean, if you just think about the origins of gynecology, we made these discoveries because a white man decided to operate and do these experiments on Black women who were enslaved and did not consent to any of those things happening to them. But that is what we have for understanding, our modern gynecological knowledge. And there's so many instances like that throughout history that define how we look at birthing justice, reproductive justice, all of these issues. And I think there is not really a way to move forward unless we all confront that in how we think about our own bodies, how we think about other people's bodies, how we judge people who look different from us in getting abortions or making their own decisions about their reproductive health. And I think one modern example of this is that when we think about policy for abortion access, the entire conversation is centered around codifying Roe v. Wade, when in reality, Roe v. Wade is something that was, obviously a landmark moment for abortion access, but it didn't actually make abortion more accessible for Black women, for women of color, for low-income women. We have policies in place like the Hyde Amendment, which prohibits federal funds going to provide abortion care. And what that basically means is that women of color aren't allowed to have abortions when that policy is carried out in practice. And we have to think about things from an intersectional lens. Otherwise, we're going to be excluding huge groups of people who are suffering the most and are most disadvantaged by these issues.
I'm so glad you brought that up, because it's absolutely true. Our movement is, our society is based on racism and white supremacy, and so you can't address the problems without addressing the root causes truly. I'm sure you all know we have a maternal health crisis, and it's not just a crisis for everyone, but it's especially, or it is a crisis for everyone, but it's especially challenging and hard on women of color and Black women, who have a much higher rate of dying or having severe health issues after giving birth. So it's really important. Again, I totally agree that we take this reproductive justice lens. So thank you for bringing that up. Do other folks have something to add to that really powerful statement?
Yeah, I just want to say that. Oh, sorry, Timmy, please go ahead.
I can finish.
Are you sure?
Yeah,
Okay.
Yeah.
I hate Zoom because I never want to cut anybody off, so I appreciate that. I just want to say what you said was brilliant, and I really just appreciated the frame and perspective that you brought to the group. And when you were talking, you made me think about how in the 60s, like Black women were experiencing forced hysterectomies and forced sterilization, and in the South, and same for Mexican women here in East Los Angeles, forced hysterectomies, and that reproductive medicine is not like just some objective form of looking at people's bodies, that there is infused with racism, and that we see the way that we kind of view like childbearing bodies when they're bodies of women of color and Black women, that we think we can control that. And a lot of that also goes back to eugenics and the idea of who is worthy of life, who is worthy of living, who is worthy of existing. So I just appreciate you bringing that up, because we have such a long way to go. And I think the hardest part about doing reproductive justice work in America specifically is that our medical system wants to deny that medical racism exists at all. And so sometimes we can't even bring the transformation we want, because we can't even have that conversation about saying, actually, the foundational practice of like gynecological medicine is racist and problematic. So let's look at how we do medicine itself. But that's a really hard conversation to have sometimes. So I just appreciate you bringing it up and the work that you do. So thank you.
Thank you.
And going off of that, I think you guys both made me realize how important, like, and this is something I think about a lot, the idea of choice oftentimes in America means, when it has to do with like sexual and reproductive health, I think it means choices for white women, whereas we're still at the point where when we're looking at women of color, it's not even an issue, we're not even there yet, we're so far behind. And like, for example, we were having a discussion, I think, at work, and we were talking about LARCs and being able to choose birth control. And it's crazy too, because during my work, I've noticed that a lot of time places that serve women of color or low income women, they often don't even have choices. It's just like, you get this one thing, and if you don't want it, well, I'm sorry about that. And I think it's crazy how you are literally guaranteeing that based on your class, you are going to get treated more like a human being. Just because you don't make a certain amount of money, just because you don't have private insurance, you're kind of cost aside. And it's like, we're actually going to tell you what you need. And I think that's crazy to me, that we've created a society where we're still not even really looking at catching up, not just like women of color, but also people who don't identify as women. I've noticed that I have to remind myself as a cis woman that like, oh, and also like trans women are included, trans men and people who are non-binary. And it's just something I want to get to the point of realizing that sexual and reproductive health also includes them. I think that we don't have enough conversations on things like helping trans people decide like if and when they want to have children. I think that's something I've rarely ever heard mentioned, instead of just focusing on like abortion for cis white women. And I think we just have so much work to do to really catch up to where we should be and what people do deserve.
This just reminded me too, the conversation about who's included in research about these topics too. And I wanted to look up the like year, but it was, you know, pretty recently when women were being included in research studies, and then we're still like, that's just white women, and we're so far behind including anyone else in our research. So I think that's a huge area that I would like to see improved in the future, is including like an actual representative sample of people in research on these topics, because like we can't move forward without including people who these things impact in our research as well. So that just reminded me.
And going off of that, I mean, that's a great point you bring up, Mallory, because right now, something that we've talked about at work is the COVID-19 vaccine. And right now, pregnant women and women who are breastfeeding are not recommended to get it because these vaccines haven't been tested in pregnant people. I mean, if you're pregnant, you're excluded from, from vaccine trials. And especially during a global pandemic, we have to find a way to move beyond that, because we know that pregnancy increases your risk of having a severe case of COVID. Yet these people aren't actually being included in the main prevention method for the virus. I mean, it's just all of these issues are layered against each other all the time, and it's, there's so many things to unpack.
No, that is a great point, especially like you said, we're in a health crisis right now, and we need to make sure that our research is inclusive and covers everyone. I know through our own research at Power to Decide, looking at contraceptive deserts, we frame it in a way that looks at the number of women living in contraceptive deserts, because that's what research is available. But obviously, not just women need these services. And so I agree, Mallory, with your point about extending research to include more people, because it's really necessary if we want to look at who actually has access to services. I also want to plug a book that takes a really great reproductive justice frame, Killing the Black Body by Dorothy Roberts. I read it in grad school, and it's just a really amazing read and looks at the history of white supremacy and the reproductive health movement, so cannot give it enough love. I'm cognizant of time, so I'd love to get to our next question, which is what women do you guys look up to in the health field, outside of the health field, and how then they influenced you? So I'm going to kick it off with Mallory.
Okay. I have 3 people, so I'll make it fast. Don't worry. So the first one, she actually works at Power to Decide. Her name's Sarah Axelson, and she was my human sexuality professor in my undergrad, and was probably the biggest factor in deciding to get a master's degree in public health and deciding to study maternal and child health. And I really genuinely feel like it wasn't until I took that class my senior year of college that I was like, oh, I should have known this a long time ago. So I think that has been so crucial for me in understanding that all of these issues are not like one-dimensional. They're so dynamic, and there's so many different layers to all of them, and we can't just focus on one thing. We need to look at it holistically. And then the second is just quick shout out to my mom, who is a nurse, and the hospital she works at in California wasn't providing abortions, and they're a public hospital. They should have been providing abortions, but so many of the nurses opted out. They wouldn't, she's a pre-op nurse. They just opted out. And so they weren't able to provide abortions in her floor. And she was the only nurse who was willing to do it. And she went to the top levels of the hospital to get them to hire more nurses who would be willing to do the pre-op and surgery care for abortions. And within the last year, they've upped the number, and they're providing it regularly as a service. And I thought that was so cool, because she didn't have to do that. That was beyond her job description, but it's something she's really passionate about. And I think she's really brought together like a coalition of nurses and doctors in her department that all care about it and will now prioritize it. And then finally, I wrote a paper on Women on Waves. I don't know if you all have heard of Women on Waves, but Dr. Rebecca Gompertz is a doctor in the Netherlands so basically in international waters, the boat has whatever laws of the country it came from. So she has like a team of medical providers, and they go to places globally where abortion is illegal or really inaccessible, and will pick up the women and then drive to international waters, perform the abortions, and go back. And now they've become much more of like, almost like a communications team about it. But I thought that was such an interesting, like creative way to kind of get around abortion being illegal in a lot of countries. So I haven't really checked in, so I don't know really what they're up to now, but I remember thinking that was such a cool idea back when I heard about it.
Oh, that is so cool, so innovative. Thank you for sharing. Deekshita, do you want to share the women who have influenced you?
Sure. I mean, there are so many, it's really hard to narrow it down, but I will keep it short because I want everyone to share their influences. But I think one thing in my life that I've been really lucky to have is that in every single job or volunteering opportunity I've had, I've been supervised by a woman. I've never had a man as a boss, which is a personal flex that I love to share, but we'll see if that changes in the future. I think first, my I call her my social justice mom, Cheryl Kleinman. She taught a class called Sex and Gender in Society when I was an undergrad at UNC, and she was really the first person who made me realize that I had a unique perspective to lend in issues of gender equality, reproductive health, rights and justice, etc. And she's someone who constantly encouraged me to advocate for myself. Like, I mean, this was brought up very briefly before we started recording, but my name can be a little bit more difficult to pronounce, and I used to shorten it to make it easier for other people. And she was the first person who sat with me and made sure that she was saying my name exactly how I wanted it to be said, and then told me, this is what you should demand of other people. It's not too much. And starting from then is when I realized that I had a unique perspective. My voice, my name, everything about me was valid to the causes I cared about. And that really pushed me on my path to be involved in advocacy and eventually in, pursuing my master's in public health. I mean, she's really what started it all off for me, but currently, the two people who I've worked under in the last couple of years, Bergen Cooper and Sarah Barnes, both, just do really incredible work. Bergen is the policy research director at Change, and Sarah is my current boss at the Maternal Health Initiative, and both of them have dedicated essentially their entire lives to improving the welfare of women and girls all over the world. And it's been really incredible for me to learn from both of them and take lessons that they've shared with me throughout my whole career. But I mean, honestly, the list goes on and on. I feel like I'm inspired by every woman I meet on the street. So I'm also inspired by all of you.
Thank you so much for sharing. Kyla, how about you? Who has influenced you in the field or outside the field?
I think the biggest thing that I could think of growing up, I had an amazing family doctor who was a woman, and I was very lucky in that sense. I had grown up with her, I trusted her, I was very comfortable with her. And I remember when I was in high school, I went and she was asking, the rundown of the questions and if I was sexually active, and I trusted her enough to say yes. And she just kind of sat her computer down and she said, okay, well, what do you see for, your future? What do you want to do? And I said, well, I want to graduate. I'd love to go to college. I'd love to have a job and I want to help people. And she said, okay, do you see a baby in that? And I said, well, no, I'd never stopped to think about it. And she said, what are you doing to prevent having a baby right now? And I said, nothing. And she said, okay, let's talk through some options. And we, decided on the option, but I was still, my grandma was in the waiting room and I was, I think, 16 years old, and I was so nervous and I didn't want to tell her, and I knew she'd have to drive me to the pharmacy and I would have to explain to her. And I was, very upset. And my doctor said, I'll call her in. I'll tell her that, you're having, very bad, cramps, you're having pains. I'll explain to her that I want to put you on this, that you didn't ask for this. And I just felt so, even though I know we should all be able to have the choice, when I didn't feel like I had a choice, she gave me sort of an out. And I don't think that I would be able to do what I do right now if it hadn't been for that. And then I think right now, just every person on my team that I work with, Kelsey Madden, Mimi Pickering, Sarah Axelson, Claudia Nunez Eddy, I think they all push me to be better. And then, just everyone who has a passion for this, I think inspires me, like what was mentioned. So yeah, this is just a great place to be.
Thank you. And I'm really glad that you had that doctor who really advocated for you. That's so wonderful. Ciara, do you want to share with us who's influenced you?
Yeah, actually, as Kyla was speaking, I forgot that my first ever, like the first ever gynecologist I had, which almost a decade ago, like took time to like ask me like my sexual orientation, like my gender pronouns, and I remember like at that time, like that wasn't the conversation in like mainstream media, and it was years later where I thought like, wow, like she was really like on the cutting edge of this work and like really made sure that I felt safe. So I want to shout out Dr. Breen because I think that she's a genius and that like just really understands empathy and medicine. So I hope that she's training other residents now because she's awesome. And I also want to shout out Cherise Scott, who runs a nonprofit called Sister Reach that particularly focuses on like HIV and AIDS as it affects like Black women, both cisgender Black women and also non-binary Black folks and LGBTQ Black women. And I think that she just does a phenomenal job at caring for that community and like also is on the cutting edge of educating people on the fact that HIV doesn't just affect men who have sex with men, that Black women and women of color have high rates of contraction as well, and we need to talk about what's going on in our communities and how to prevent that. So I just appreciate that. And lastly, my sister, because she really challenges me always to advocate for my medical care, to ask questions, to switch doctors if I don't feel like my care is like being held with intention. And she reminds me that like I'm worthy of holistic care. And I think sometimes as Black women and women of color, like walking into the doctor, you already can feel this power imbalance. But she reminds me that like I am the master of my body and I know what I need. And that if something doesn't feel right, I have the right to speak up and say, hey, this kind of care doesn't feel right to me. And so I think I would love to see more women being empowered to really take ownership of their care and know that they can say to doctors, this doesn't feel right. I do not feel comfortable with this, and really stand their ground. So I'm appreciative for her as well. And to echo Deekshita, all of you, because as someone who doesn't have an MPH or come from this work, from that framework, I've learned so much from you all today, just from your research and the way that you engage in the community is really inspiring. So thank you for just all that you all do. It's pretty awesome.
Thank you as well, obviously, for what you do. Also, your sister sounds awesome, so thank her for us. Temmie, what about you? Who's influenced you?
I think first it's crazy because while Deekshita was talking, I was thinking about like, wait, yeah, I've never actually had a male boss either. Like, and my like internships and working in this career, and I think it's crazy too. Working at Power to Decide, it was hard to pick out like one person there. I think that I've had a very rare experience as my first job out of college, especially as a woman, and feeling little things like I won't be spoken over in a meeting and people are going to actually ask me to repeat something, or something as simple as like working there. And during my tenure at Power to Decide, there's been 2 Black CEOs, and that's something that they tend to, I mean, nowhere is perfect, but they tend to really prioritize, I think, and they bring such a new kind of framework of thinking things that I haven't had in like former places where like I haven't worked with women of color before. And seeing so many women of colors not just working at the organization with me, but actually leading, I think has been such a great experience. And I know that I'm very lucky to have that. A lot of people don't have that. And that's something I think of every day. And even at Power Decide, I'm around so many women who like push me to do my best. And it's even like working with you, Sam, has been great. I've learned so much from you working together. And I guess like outside of that, I would say Lauren Underwood. She's a congresswoman in, I want to say, Illinois, and watching her come from a medical background, but also coming as a nurse. And I think that a lot of times they tend to kind of like look down on nurses, even though they work really hard. And I think it's great for her to come down and actually say that the Black maternal like health crisis is just something that I think about. She ran on that, and she kept on talking about that, and she made that kind of the centerpiece. And even making public health the centerpiece of her career is something that I don't think a lot of people have done, especially before COVID. So she's also, I think, one of the people who I feel like has taught me a lot, just like being able to follow her career.
Well, thank you so much, Tammy. I also want to say I love working with you as well, and I agree. It's hard to single out people at Power to Decide because there are just so many amazing women and people that we work with. Like a lot of you, I've had a lot of female bosses as well. So it's really been wonderful throughout my career to have such strong mentors, not just in the fields, but also outside of the fields, reminding me to be confident in myself, be true to myself, and show the world that I am capable and knowledgeable. So thank you all for sharing everything today. It's been a really great discussion. And again, thank you for participating during Women's History Month. Be sure to follow Power to Decide on social media, and you can rewatch this video on YouTube. So thank you so much.